Great, thanks everyone for joining us. Hopefully you can all hear us okay. I'm Ailsa Villegas and I've got my colleague Kate with me today. We're going to talk to you about health inequalities and nature-based solutions. Kate's just going to be letting a few people in as they join, because we've got quite a few joining us today. In this session, Kate and I are going to explore the interconnections between public health, climate change and biodiversity loss. And we'll collectively share our thoughts on how this relates to our work on tackling health inequalities. We're going to be sharing some slides, but there will be opportunity for discussion and for you to contribute your thoughts at key points within the presentation. We're pretty tight for time, so I would ask that if you have any questions as we go along, please use the chat function. You should all have access to the chat function today. All the slides and the reference list will be shared at the end, and we'll send it all by email afterwards as well for you. And just to make you aware that today's meeting is going to be recorded. And if you can keep your mics on mute until the points that we're going to be contributing, that would be appreciated. So firstly, I'll introduce ourselves, and we'll introduce ourselves so you can understand the lens at which we're sort of presenting to you today. So as I say, I'm Ailsa Villegas. I've been working in health development for 7 years now, mostly coordinating the work of the Highland Green Health Partnership. And prior to this, I was for many years working in sustainable development and climate change policy. And I started my career as a countryside ranger. I studied a degree in zoology and a master's in managing sustainable rural development. What we're presenting today is our experiences. We're by no means experts, and would love to be guided by you out there as well. And I'm going to hand over to Kate, who's going to introduce herself now.
Thanks, Ailsa, and hello everybody. My name's Kate Thomson. I work with Ailsa in NHS Highland Health Improvement Team as a health improvement specialist. I'm quite new to this post. I started first of all working for the Highland Green Health Partnership, and prior to that was working in community development around green health, and have a background within nature conservation. So studied a degree in zoology, followed by a master's in psychology, and so I have an interest in the kind of interplay between nature connection and nature conservation and mental health as well. I'll pass you back to Ailsa, who's going to take us forward with the presentation.
Thank you. This presentation was initially pulled together so that colleagues within our public health department had a better understanding of our role and why it matters for the health service. And we decided to roll it out to others in Highland who may be interested. And it's really great to see such an interest in this. Actually, we had 100 tickets. I don't know how many will join today, but 100 tickets went, and I know it's gone beyond Highland. So we'll try, and for those of you who aren't within the region, make it relatable for those of you who might not be familiar with our area. But really, we're going to be sharing some of the principles and theories that underline our work, and some of our local experiences and actions we've been taking at the end. So I'll just commence with the presentation. So firstly, as an introduction, nature provides for us. Nature provides for us. Nature supports our well-being. It protects our health. It enhances our health, and it can also be a threat to our health. And all of these experiences, both positive and negative, aren't experienced equally across society. And as we go through the presentation today, I would love it if you could just be mindful that we are part of nature, but we as humans are also a threat to nature and the systems that sustain us. So I'm going to start with ecosystem services. These systems are called ecosystem services and are the direct or indirect contributions ecosystems provide for human well-being and quality of life. Ecosystem services are at times referred to as natural capital. They are one of the building blocks of human prosperity and well-being. This can be in a practical sense through providing food and water and material for housing and clothing. But ecosystem services also have a role to play in regulating our environment, such as controlling floodwaters, our climate or air pollution. Processes in the ecosystem help to support us through soil formation and plant growing. And of course, nature provides us with the oxygen that we breathe. And there are also cultural aspects, such as reducing stress and anxiety, and used for heritage and recreation. The concept of valuing nature as essential to our well-being has been around for a very long time. John Muir, who's a fellow Scot and founding father of the national park movement worldwide, recognised the cultural aspects of nature in the mid-1800s when he said that everybody needs beauty as well as bread, places to play in and pray in, where nature may heal and give strength to the body and the soul. Indeed, nature is fundamental to our human existence. A healthy natural environment is absolutely essential. And here in Maslow's hierarchy of needs, the theory explains that the needs lower down in this triangle, the wider needs at the bottom, must first be met before we can fulfill the needs higher up. The natural environment provides us both with our physiological as well as our safety needs, such as resources, health, and property. But it's not just our basic needs at the base of this diagram that are met through the environment around us. The psychological needs, for example, our feeling of connection, can be fulfilled through connection with nature. For example, loneliness is a significant mental health concern, and connection with natural world can buffer a lack of social connections by inspiring a sense of belonging. One study showed that when people were able to see trees or sky, or hear birds, feelings of loneliness fell by 28%. Other studies show that connection with nature can really increase our sense of self-esteem. Connecting with nature is really, really good for our health. And this list here is just some of the many health benefits you can get from connecting with nature, as summarised in a Dose of Nature summary report by Exeter University. Spending at least 120 minutes a week in nature is associated with good health and well-being. And connecting with nature is also really good for our health service. It provides very good value for money. A project called My Place by Lancashire Wildlife Trust found that for every £1 invested, there's £2.16 of additional benefits in terms of reduced costs to the NHS. When we come to looking at prescribing medicines, the prescription of medicines accounts for 11% of total health spend in the UK. That's £20 billion. And connecting with nature can help to avoid, postpone, or reduce the need for certain pharmaceuticals. And reducing the need of pharmaceuticals can also result in reduced waste. All those pharmaceuticals come with packaging and reduced carbon emissions. And medicines and their packaging currently account for the largest proportion of all NHS carbon emissions, that's 25%. There's also really good benefits for the individual as well. On average, each one of us spends just 3 hours a year with an NHS professional. And that leaves the rest, 8,757 hours, for self-care. So nature and connecting with nature can be a really valuable tool in our self-management toolbox and help to keep us healthier for longer and help us to recover more quickly from illness and injury. But not everyone has equal access to nature. This data here is from the Scottish Household Survey, and it's for Highland, and it's the percentage of people living within 5 minutes walking distance from the nearest green space. And it's probably no surprise to find that more people in the most affluent area live closer to green space than those living in the least affluent area. It's also probably not surprising to see that those with disability or health issues are less likely to visit the outdoors. However, the numbers visiting the outdoors are increasing and have been growing in recent years. So on the left-hand side, we have those who don't visit at all, and we have the data for Highland and the data for Scotland as a whole. So back in 2019, we had higher numbers of people not visiting nature at all. Those numbers have dropped significantly in that between 2019 and 2022, both for Highland and for Scotland. And then we look at those visiting most frequently, once per week or more. We can again see that between 2019 and 22, they have been increasing both regionally and nationally. And the trends seem to be a little bit higher in Highland than the national average, which is great news. If we look at the frequency of visits to the outdoors by deprivation index in Scotland in the once per week or more, I think the key thing to message here is that both those in the most affluent and the least affluent areas have been increasing their engagement with the outdoors, which is great news as well. So nature is ecogenic, and by that we mean it has the ability to close the gap in health differences between our richest and our poorest communities. So in this slide, the dark red income group are the wealthiest and the blue the poorest income group. And what you find is as access to green space is increased, the gap between the wealthy and the poor narrows, both for all cases of mortality and deaths and for deaths from circulatory disease. So health inequalities are the unjust and avoidable differences between the health of different groups of people. And these are largely influenced by socio-economic factors. If we look to the little figure on the right of this, the area in blue is the area we tend to focus on in health and social care. But the area in green are all the other things happening in that person's life that can impact on a person's health. Now, the Dahlgren and Whitehead model to the left details these social determinants of health. The idea being that at the centre, there are things that cannot be changed, such as your age and your genetic makeup. But as we move out from the centre, we lose more control of the things that impact on our health. So it's not just about lifestyle choice, but it's also where we live and work and the political environments around us. The environment plays a role in this, but for me, it's quite an anthropocentric view. The wee figure to the left only has 10% of our health attributed to environment. However, I would argue, as an environmentalist, that that's the most important 10%. And I like to visualize it as a wee mat that the person's sitting on. Because while you can still exist, albeit in bad health with drug addiction or no access to healthcare, you cannot exist without air to breathe or water to drink, and that's provided by the environment. So I've tried to expand on the social determinants of health a little bit more. In the next slide, I've highlighted those areas currently in the model that talk about environment. So the environment determines our agricultural processes and food availability. It determines the quality and location of our housing, the availability of clean, safe drinking water and sanitation, our working conditions and our living conditions. It can even influence our social and community connections and our individual lifestyle choices, in that living in poor natural environments is known to be detrimental to both. And even this fixed area in the middle, around your age and sex and your DNA, is actually determined. Sometimes your DNA is determined by environmental factors, as over generations, the expressions of our genes, this expression of our genetic makeup is shaped by the environment in which we've lived. So I've expanded the environmental determinants a little bit more here to include some of the additional environmental determinants that aren't represented in the Dahlgren and Whitehead model. And these include air pollution, soil quality, the ability to grow food, exposure to chemicals such as pesticides, heat risk, flood risk, UV radiation, vitamin D, noise pollution, weather events, exposure to waterborne or vector-borne diseases, and biodiversity. I'm now going to talk a little bit about biophilia. Biophilia means the love of all living things, and was first coined by Erich Fromm in his book from the same title that suggested that a loss of biophilia was leading to negative effects on our well-being. The theory is that if biophilia delivers benefits to humans, then our increased distance and detachment from the natural world due to urbanization or technological advances and other factors, this could have a negative effect on our well-being, not to mention on nature itself. So I personally have a very strong sense of biophilia, perhaps because of my rural upbringing, perhaps because of all the David Attenborough documentaries I loved to watch as a child. But the important thing to note about biophilia is even where it isn't present or it has been lost, it can be created, nurtured, and grown. And we can proactively help people to connect with nature, thus increasing a sense of biophilia and improving their health. And biophilic design is an architectural term referring to the practice of bringing nature into our built environment, and in doing so, increasing our sense of the love of nature. So I've got a little bit of an interactive activity now, and I'd invite you all to use the chat box for this function. I'm going to show you 4 photos in succession, A, B, C, and D. And I just want you to reflect on how each photo makes you feel as I present them. And then once you've seen all 4, I'll invite you to pick the letter that you like the most and pop it in the chat function for me. So here's photo A. And B. Photo C. And photo D. And here's all the photos together. And if you'd just like to pop a letter in the chat for us there, take a vote for which one you like the best. An almost unanimous D. Yeah, well done. I actually quite like C. I think it's because I've got a personal aversion to freshly cut long grass, and C didn't have as much of it. So it's quite interesting. Now, would anyone like to come on the mic and just say, you know, reflect on how D made them feel? Or write it in the chat. How did it make you feel as we were progressing towards it? Did it invoke any feelings? Calm and welcoming. Thank you, Rachel. Alive. Thanks, Dawn. Happy, welcome, interested, like nature was important, soothing. I feel more energy. Softer. Lots of really positive expressions there. Thank you. Oh, Lorraine's in my Lorraine's in my camp. D seems a bit unkempt to me. I'm a C fan. Yeah, the top of the roof. Yeah, I do wonder the state of the concrete underneath it. More relaxed makes me feel, A makes me feel tense. Yeah, that's very good, isn't it? So nature can relax us, it can reduce stress, just as we were saying. I'll just take one more. Refreshing after seeing the starker A and B, however, compared to completely natural, it might evoke a different reaction. Yeah, I mean, we're benchmarking here, isn't it? We're not comparing like for like. But you get the idea that you have a more positive sense, an uplifting sense of being in an environment like C or D more than A or B. So thank you very much for your contributions. So at this point in the presentation, what we should have learned is that nature makes us feel good. A healthy natural environment is essential to our human well-being. Nature can support good physical and mental health. Connecting with nature can ease pressures on our health service. Contact with nature can help to close the gaps in health inequalities, and people both rich and poor in Highland have been increasing their time spent outdoors. So that's nice, that's really positive. Now for the slightly less positive news. What this slide shows is that since 1992, the world has become wealthier, our produced capital has grown, but that wealth has not been distributed evenly because our human capital, which is the green line, which contains our collective knowledge, our skills, and our health, has remained relatively the same in that time. However, in the process of becoming wealthier, the natural capital has been depleted, and those ecosystem services in which we are fundamentally relying on for our survival as a species are declining. If this continues, what we'll find is that human capital line will start to taper off and follow that natural capital line and start to decline. This is another way. This slide is actually bringing it up more in time in line with our current timeline. The blue dotted line shows the sustainable levels at which we should be using our resources. And as you can see, the current business as usual is taking that resource use, that ecosystem service, that natural capital use, way below what would be sustainable and can be replenished. And so now I'll leave you with Kate to take us onto some of the negative health impacts of that.
Thanks, Ailsa. So we did joke at the beginning in the planning of this session that Ailsa's good cop and I'm bad cop, because now I get to outline the situation that we're facing globally and why it matters to our health. So first of all, I just want to say, I'm not an expert in any of this. I'm really learning as well. I did recently attend carbon awareness and sustainability in healthcare training, which was really useful, and I highly recommend it. It's not an accredited course, but it's run as a series of webinars by a community interest company with a very unmemorable name, Press Quip, I think is how you say it. And it's promoted through the Sustainable Healthcare Network. So it's particularly relevant possibly for English colleagues that are potentially on the call, because it does link to policy and strategy that is based in England. However, as an overview, it's really applicable as a baseline understanding for everyone. And we'll signpost to the learning resources such as this at the end of the session and within our reference list, so you can check that out for yourself. But this next section is just a brief overview of the main challenges we face and starting to introduce some of the links to health. So one of the key messages we're hoping to deliver in this session is that there is a high interrelatedness between the loss of biodiversity, climate breakdown, and air pollution and human health. And these three factors can be thought of as the triple health threats facing humanity. They all impact human health directly and indirectly, and we're going to have a brief look at each of them in turn. So this summary is mostly from a UK and often from a Scottish perspective, and I think it's important to keep in mind that the impacts on people and health in other parts of the world, particularly in the global south and within less developed nations, is being felt disproportionately and keenly. And so while we're highlighting the risks to inequalities and health close to home, these exist on the global stage in a really stark and important way. So air pollution is the first part we're going to look at, and it's linked to 7 million premature deaths annually and globally. In Scotland, relative to the rest of the UK, we do actually enjoy high levels of air quality, but over the last 3 decades, the levels of main air pollutants have declined significantly, but there are still pockets of challenge. So, for example, in Inverness, the nitrogen dioxide levels have been problematic in certain streets. And the example of wildflowers is a good example of this issue and how an issue that can be exacerbated by climate change and have impacts on air pollution. So I know our Highland-based public health colleagues were involved in communicating to the public in response to really serious wildfires last year, for example, advising people to keep their windows shut and other measures in order to reduce the health impacts of those really serious wildfires. The diagram, the image, of the UK on the screen there shows the air pollution levels today. So I updated it this morning, and we can see that actually today, relatively speaking, that the whole of the UK is enjoying quite good air quality. But that does change on a day-to-day basis, dependent on lots of different factors. So the biodiversity crisis. So the term biodiversity describes the variety of all living species on Earth. So here we're thinking about animals, plants, bacteria, fungi, and the complicated web of interactions that they have. So Nature Scot produced a State of Scotland's Nature Report this year and highlighted that we continue to lose biodiversity at a really alarming rate. 15% of Scottish wildlife has decreased on average by 15% since 1994, and 1 in 9 of Scottish species are now at risk of extinction. A recent report from Bugs Matter came out just in the last week, showing that we have had a 78% decline in invertebrate numbers in the last 10 years. So this is a really good example of a citizen science project, and they monitor the amount of insects found on people's car registration plates, which feels slightly unfortunate that the way they're measuring this decline is through the death of these individual insects, but it does provide a sort of good measure of where we're at, and that to me is a very alarming figure. And I think that, you know, that's all the commentary about this report has been that it's a very significant decline that we've seen. So we do know that recovery of biodiversity is possible, but it's highly unlikely that we're going to return to historic levels. So we can think, we call this shifting baselines. And this next slide gives an infographic which gives an indication of where Scotland, Wales, Northern Ireland and England sit in comparison to nearby countries. So Scotland has a biodiversity intactness score of just 56%, which gives an indication of how much nature is left in Scotland compared to historic levels. And this is significantly lower than other places. For example, Finland sits at 89%. A recent report by the Green Finance Institute explains that at least half of global GDP is moderately or highly directly dependent on nature, and that the damage to the natural environment is also harming the economy and could lead to a loss of 12% UK GDP. So we're sort of starting to see how nature and biodiversity is relating to the resources that people have available to them, which obviously has links to health. A smaller example of this link to ecosystem services that biodiversity offers is in a recent study that looked at the value of 4 NHS hospital sites in England and looked at the value of the trees on those sites. And the study estimated that they provide annually around £85,000 worth of services. So some of the things that Ailsa mentioned previously, like flood prevention and heat reduction and pollution absorption, for example. So the last of the triple threats that we just want to have a brief summary of is climate breakdown. And as we all know, our climate is warming at unprecedented levels due to the burning of fossil fuels. And the average temperature of the Earth's surface is now about 1.1 degrees warmer than it was in the late 1800s. And the Paris Agreement, which was ratified at COP21 in 2015, outlines global target to keep temperatures from exceeding 1.5 degrees above pre-industrial levels. But much of the modelling now says that we've locked in increases beyond 1.5 degrees. So in September last year, the global average temperature reached 1.8 degrees above pre-industrial levels. I suppose a question you might ask is, why does this matter, and how can such small increases result in such important large changes and impacts? And I think the concept of planetary boundaries is useful when trying to understand this. And I would recommend the Netflix documentary Breaking Boundaries to explain this more fully than I can here. But essentially, scientists have identified 9 parameters that make up the integrity of our planet, and they provide a way of measuring impacts. So while this diagram is not particularly clear, we can see that the green zone represents a livable planet, and the red and orange indicate the parameters that we are going into unlivable areas. And you can see since 2009 that those have both increased in number and how far into those boundaries we've crossed. And so one of the things the documentary does really well is it describes how some of these boundaries can include tipping points, and so beyond which it's really hard to predict the outcome because there's feedback loops that are involved that mean that there might be no way to return to safe limits. And so we know that every increase in global temperatures will intensify and multiply current hazards. So what can we expect to see in Scotland as a result of some of these changes that we are experiencing in our climate? And this, although this is, I've put this to Scotland, it is relevant, I think, to the rest of the UK as well. So we know that we're going to be experiencing warmer, drier summers, milder, wetter winters, and that the increase in variability in our weather systems and sea level rise will have associated impacts of flooding and coastal erosion as well. I wanted to just highlight a local project that is happening. It's a local partnership called Highland Adapts. and they have an interactive and live story map project on the go, which is recording some of individual and community stories of effects of climate change right now. And it's a way of mapping some of the impacts that we're seeing, and also thinking about risk, but also about resilience as well, and what the kind of opportunities are, a way of measuring impacts and trying to record people's experiences is worth having a look at. So it's really clear that planetary health is human health. And this diagram on the left here, while a really horrible colour in my opinion, shows that one way of conceptualising this is to place human health at the centre of the issues that we face globally. So the importance of these issues to human health was recognised at the most recent climate change conference, COP28, and they did hold a health day where world health leaders came together, and this underscored a growing recognition of the intersection between climate change, nature loss and human health. And it's interesting that that's the first COP that had happened at. So we've had 28, and this was the first time we had a day recognising these links. And as Ailsa said earlier, some people might consider this a very anthropomorphic view of the issues facing our planet. Perhaps another way to look at it is that by viewing the challenges through this lens, we might inspire some of the much needed action required to reduce the impacts and adapt to the changes. So the interconnections and feedback loops between climate, nature and health are complex, they're numerous, they're reinforcing. And as our senior health leaders recognise, these challenges are fundamental to our health and ultimately to our existence. And they should be everyone's focus and concern. Now, I know many of you will be coming to this session with a real wealth of expertise and knowledge, and perhaps none of this is new to you, and that you already think about the underpinning impact of the integrity of our environment on all aspects of our work. But generally, it's recognised that more needs to be done to embed this way of thinking into our day-to-day work. For example, in the area of public health, a recent article in the Lancet Public Health Journal highlighted that acting on the climate crisis is a clear yet still neglected priority for public health. And the quote that's on the slide on the screen there is a quote from Professor Gregor Smith, who is our Chief Medical Officer, highlighting exactly that the time for thinking of sustainability as somebody else's job or as a nice thing to do is gone, and that really it's population health is inextricably linked to action to tackle climate change. So it feels positive seeing our key leaders espousing this message and hopefully generating some action. So NHS Scotland have set out nationally what we need to do in the climate emergency sustainability strategy, and it's a really good document and has a lot of good ambition and is worth a read. And this includes objectives around green spaces, green health and biodiversity. And I know that NHS England have a similar document, which I think is titled Journey to Net Zero. I can't remember the exact title, but there is an equivalent in England. So it's, we know that our organisation is thinking about how we're going to do this. So what are the impacts that we're talking about here? We've kind of talked about some of them as we've gone, but this is now a chance for us all to get involved, and we really invite your participation in this next activity. We're going to ask you to list as many of the impacts of biodiversity loss, climate breakdown and air pollution as you can, and we're going to do this through a Jamboard. So Ailsa has just shared the Jamboard link in the chat, and if you could follow that link, that would be great. I think Ailsa's also, I'm going to hand back over to her because she is going to share the Jamboard live so we can see people engaging with this activity.
Thanks, Katie. I'm just going to share my screen. For those of you that may not be familiar with the Jamboard, I'll just show you what we need to do. Can you see my screen okay, Katie?
Yes.
Yeah, great. So on the left-hand side of the Jamboard, you can select a little sticky note here. It really doesn't matter what colour we do these in, just pick a colour and then write your impact in here as well. So heat stress, I'll put one in, and it automatically pops onto the Jamboard. And as you do this, yep, folk have started already, brilliant, great. As you populate it, we'll watch it come up, and I'm going to start moving things around and we'll have a little bit of a discussion. But firstly, take the first 5 minutes or so just to fill in your post-it notes of the impacts. Thank you. Oh, lovely. I'm seeing a positive impact coming in here. Well done. Another positive one there. Okay, great. We'll pause there. They came in thick and fast, everyone. Thank you. I'm still trying to make sure I haven't overlapped them. Eco-anxiety was there as well. I don't know why they all popped in the same place, Katie. More community engagement, another positive one in there as well. Right. Yay. It's not perfect, but what I tried to do while you were popping it up there, it was a real speed test. I may have got some of them in the wrong place. Was divide them into direct impact, which I've got on the left. Excuse my scribbles. And then indirect impacts. Kate, do you think I've got any particularly wrong?
I can't see any, Ailsa, but if anybody else on the call wants to come on and comment on that, you're welcome, or pop it in the chat if there's any you think are in the wrong place.
There's quite complex ones in there as well. So, but the idea being, there are some things it's very obvious that they're happening. You know, I can't get this flipping thing off. There we go. Heat stress, waste of natural resources, wildfires, mental health decline should probably be an indirect one, actually. Eco-anxiety, they're quite obviously direct impacts. If we go over to the right-hand side, wars, migration, large global indirect, as resources become scarce, people compete for resources, people have to move to find resources. There's an increase in poverty. Asthma, respiratory diseases, these are like the threat multipliers. If people already have a pre-existing condition and we get large sand plumes up from the Sahara over, it can make breathing quite difficult with people with things like COPD and asthma. There's some other complicated ones, and I'm just going to open up the chat now. Hopefully you can all see that, to ask which ones. There are some very obvious ones that impact on our health, like increased COPD, eco-anxiety, but mental health decline. But what other ones might impact on our health in here? And would anyone like to expand on it in the chat, particularly if you've put that post up there? Just now thinking about impacts on health. Excuse me, my dog's just barking. Apologies, Katie. Could you take over the chat for a section?
Yeah, of course. Yeah, so the invitation here is just to think about some of the impacts that people have written down that maybe aren't at first glance obviously directly related to health, but to think about some of their impacts on health. I don't know if anybody has any ideas that they want to offer for that question. That may be somebody trying to come in there. We've got a comment in the chat there, so thinking about food security and crop failures could lead to possible malnutrition. Absolutely. I'm also thinking about how crop failure might relate to somebody's livelihood, and that has impacts on their family's health, for example. Food shortages making food more expensive and therefore limiting choices to less healthy options. Yeah, absolutely. Rachel, you've popped animal-plant migration. I'm interested in how you see that as related to health. That would be interesting to hear. Increasing cost of food from some of these less obvious impacts, like crop failure, for example. Some of the impacts can relate to cost of living crisis and food poverty. Yeah, definitely. So I think it's probably fair to say that if we were to take any one of these impacts that we've written down here, we could link it to our health in some way, shape or form. Rachel's expanded there, saying that animal-plant migration could bring unknown risks and viruses. Yeah, absolutely. Yeah, definitely. Thanks for inputting to that section.
And thank you, Katie, for taking over there. My dog's just somebody came. I was dreading someone coming to deliver something during this, and they did. So it's all
That's okay, no problem. I'm just sharing the presentation, so we can just go back to that now. It just might take me a wee minute to get back to the slide we were on, if you just bear with me while I do that. So yeah, so this diagram just is a bit of a summary diagram of the direct and indirect effects and impacts of climate change on health and well-being. And it was adapted for use by Public Health Scotland. And I think actually, I don't know if anybody can see anything in there that we didn't cover. I am not seeing anything that's jumping out at me. I'm not sure if coastal erosion was mentioned as a direct impact. Some of the sort of more indirect effects, we've talked about zoonosis, vector-borne disease, income is being mentioned in the comments. Yeah, absolutely. And all of these things are exacerbated by existing inequalities. So that blue column there describes the parts, the sections of that are describing existing inequalities. So why are we thinking about this? So hopefully it's quite obvious, but climate breakdown, air pollution, and biodiversity loss, they affect population health and well-being. We know that these effects can be direct, relating primarily to changes in the frequency of extreme weather, for example, or biodiversity loss, and they can also be indirect through changes to our ecosystems and through effects that are mediated by human systems. And we know that these are threat multipliers, so they amplify pre-existing health problems and inequality. So I read somewhere recently about the impact of heat events on domestic violence, for example. So we know that when a heat event occurs, that domestic violence increases. So there's an existing inequality and health issue in domestic violence rates, and that climate change can amplify these existing problems. So I'm going to hand back over to Ailsa, who's going to just talk through the next section.
Thank you. So really, this is an issue of social justice. Often people most impacted upon by these environmental changes are the least empowered. And the way in which they are impacted upon will depend on their sensitivity to those impacts, including where they live, where they work, their current health and their age, and also their adaptive capacity, their wealth, their education, energy supply and access to healthcare, housing, social cohesion and transportation, and their behaviour. And the picture here is a recent picture that took place with Storm Henk in southwest England earlier in the year 2024. So in Scotland, one of the indexes we use to try and identify those groups of people who might be most adversely impacted by these kind of events is the Scottish Index of Multiple Deprivation, the SIMD. It's one tool that's available to us, and it helps to determine where our most vulnerable groups of people in society may be by providing maps. It combines 7 different aspects of deprivation across income, employment, education, health, access to services, crime and housing. And it uses 26 indicators across these domains. Geographical areas are given a score, and they're ranked by each domain from 1 to about 7,000. And then the domains are combined to provide a measure of relative deprivation. So it tells you that one data zone is relatively more deprived than another. Of the 26 indicators used to calculate SIMD, none of them are on that environmental determinants list that I showed in one of my previous slides. Now, I'm not saying this isn't a good tool, it's a great tool. What I'm saying is there could be other indicators to look out for. So what I've shown here is an SIMD map of Inverness, and we have a community here called Merkinch, which is circled there. It's dark red because it scores quite lowly, quite low scores on the SIMD index, meaning it's one of our most deprived communities in Highland. However, saying that, Merkinch is actually home to one of the only local nature reserves, in fact, the only local nature reserve in Highland, Merkinch Local Nature Reserve. And what we have is a very high quality green space adjacent to a very large population with high deprivation indexes. So that's a really positive environmental indicator that we should be looking to. But also on the flip of that, Merkinch is also very close to sea level, if not below sea level in some areas. And it's an incredibly high risk from coastal flooding. And this data set taken here is produced by Climate Central, and it's based on the median sea level rise scenario for coastal flooding in Inverness, taking into account tides, sea level rise, and storm surge. And this is just 25 years away, and it's not even the worst case scenario, but you can see that the entirety of Merkinch is at risk from coastal flooding. So that's an incredibly negative environmental indicator we need to be considering when we're long-term planning for this area. Now, there are new ways being developed to look at how we identify our areas that require most investment, and the tree equity score was introduced last year. Oh, look, Sinclair's got it up. Yeah, you preempted me. So the tree equity score is finding that trees are essential to public health and well-being, yet not everyone has good access to trees and their benefits where they live. It shows that trees' presence is strongly correlated to wealth and to race. And the tree equity score combines information from a variety of sources to create a single measure from 0 to 100. And the lower the score, the greater need for investment. So what I've shown here is two pictures. Unfortunately, there isn't a tree equity score for anywhere in Highland currently. It is a fairly new indicator, so we're looking forward to welcoming that. But what I've got here is pictures of Glasgow, and circled in the top picture is the tree equity score. So the darker the green, the higher the score. And this area circled in red here is Bearsden. So it's a fairly wealthy part north of the River Clyde, which has a high tree equity score. It has a lot of trees. And if we compare that with its rating on the SIMD map, which is on the bottom, you'll see that Bearsden is coloured blue. And actually Bearsden has, in terms of the health indicators for the SIMD, one of the healthiest indicators of any community in Glasgow, which is why it's coloured blue. If we compare that with Govan, which is south of the River Clyde, you can see on the SIMD score, it's very dark red. And actually Govan has one of the poorest health indicators in the SIMD in that region. And if we also look up to the tree equity score, you'll see that Govan has a much lower tree equity score as well. So this opens up questions around cause and effect. Are the people of Bearsden in part healthier because their environment is more biodiverse, or is their environment more biodiverse because they are wealthier, and this in turn has led to better health? I don't know the answers to these, but it does raise the question that, you know, is enhancing biodiversity a more worthwhile investment for improving health than some of the other traditional methods that we maybe look at in public health? And why are trees important? This is a nice slide that helps to indicate the importance of trees. They create shade, they clean our air, they provide shelter from wind, and they slow the runoff of rainwater, and they also increase biodiversity, which we know has good indirect links to our health. It's also worth noting on the lower slide here that this street has good infrastructure for walking and cycling, and the top slide doesn't have there. Although the top slide could be argued as being quite affluent in that it's got cobbled streets and looks like a nice commercial area. So that was just a bit of food for thought about some of the indicators we use. Now we're going to go on to the good news, and some of the things that we're doing in Highland to help proactively work towards this. I'm just going to hand back to Kate to take over this bit.
Thanks, Ailsa. So yeah, the good news. So there is some good news. We had a lot of kind of quite heavy and hard. I find it quite overwhelming when I think about all the impacts of these things, and so I think it's good to think for a bit about the good news. So we know that responding to the climate crisis and biodiversity loss could be the greatest global health opportunity this century. that was stated nearly 10 years ago and is as relevant now. And we've got some lovely examples here in Highland to tell you about. First of all, we just wanted to think a little bit about the fact that given that the impacts of climate breakdown and the biodiversity crisis are directly related to health impacts, it makes sense that action to mitigate and adapt to climate change and biodiversity loss has co-benefits for health. And I'm afraid that my example is not showing on this slide, so I'll just talk you through it. And you can focus on the lovely picture of the wildflowers there.
Assalamualaikum.
If I could just ask everybody to pop their microphones on mute, that would be really helpful. Ailsa, I don't know if you can go through the list and just put people on mute. That would be great, thank you. So the example that I wanted, oh hang on, I'm just going to wait till this is sorted. Let me just go through and I'll just get that muted. There we go. Okay. So the example that I wanted to talk through was a biodiversity enhancement project. So projects that are looking at, for example, improving habitats for pollinators. So these projects obviously have a really direct and obvious benefit for insect numbers. They are they're projects that are increasing perhaps wildflower areas, and they're creating homes for insects and a food source. So that's a really obvious benefit to biodiversity. And also that these projects have benefits for human health. So we can think about the quite tangible impacts around improving nature connection opportunities, creating beautiful spaces where people can observe nature, connect with nature. They might get involved in citizen science, or they might get involved in actual conservation projects that are managing these spaces. And then we can go wider than that. We can think about some of the less tangible impacts that a pollinator project might have, such as increasing crop yields, increasing the availability of locally produced, more variable food sources, and potentially even reducing the cost of these food items. So this is a nice example of how climate action can have co-benefits to health. And I'm just noticing in the chat that Sinclair has popped a link in there to Aberdeen Beeline's Bug Life project. So Bug Life obviously are involved in lots of these types of projects. And there are loads of other examples. What you can't see in this slide is a link to an Imperial College paper that goes through lots of different co-benefits to health, and that'll be included in the reference list, and it's worth looking at because it has lots of examples beyond biodiversity projects as well. Oh, there we go. All I needed to do was click to the next slide. There we go. You've got you have the text in there that you've heard me chat through. So we know there's also a growing body of evidence that people who are more connected to nature are more likely to engage in pro-environmental behaviour. So there's this like win-win-win situation that whereby, I mean, it makes so much sense, doesn't it, that all the interrelatedness between climate breakdown, biodiversity loss, and health, all the negative impacts are also have this interrelatedness that we see in the positive benefits as well. And I'm going to hand back to Ailsa, who's going to talk through some of the actions that are underway in Highland in this regard.
Thanks, Kate. So just before I go on to share some of the things we've been doing in Highland, I know that many from outside Highland, it may seem that accessing nature is easy for us. We admittedly live in one of the most sparsely populated and rural parts of the UK, surrounded by exceptional quality green space. And in that respect, we are very lucky. We've had a Highland Green Health Partnership here working for about 5.5 years. It's a cross-sectoral partnership, and it's been funded through our Natural Health Service until recently. It's just being adopted more. The Scottish National Funding finished. And we work to promote connection with nature for health of our population. A recent review of the partnerships found that we're all facing similar barriers to implementation. Progress is being achieved, but it's not without its challenges. And that's perhaps for a whole other presentation another time. But one of the successes we've had has been our Think Health, Think Nature programme of work, where we've created an online directory of nature-based activities and are working with health professionals to prescribe nature. We've also teamed up with RSPB and Caithness to produce a nature prescription, and elsewhere have produced self-guided materials for distribution through link workers, occupational therapists and mental health support workers. We've also delivered a lot of small grant funding and training for activity providers to try and close the gap in areas where we don't have green health activities available. And I will say the self-led resources are incredibly valuable to us in a rural authority area, because it's just not possible to sustain group activities in some of our population zones, because there's just not enough of a volunteer turnover there. So I'd encourage you to check out our website there, thinkhealththinknature.scot, and there's loads more information on what we've been doing around that on that website. And Kate's going to tell you a little bit about the hospital green space work.
Thanks, Ailsa. Yeah, so improving our hospital green spaces for nature and people is part of the NHS Scotland environmental strategy. And hospital green spaces
just 1 minute.
Sorry, 2 seconds. I think that, yeah. So hospital green spaces can be part of upstream interventions that aim to reduce health inequalities. So, for example, we can increase access to nature for staff, for patients and for local communities. We can play our part in carbon capture and storage, join nature networks. We can provide space for community food growing areas and encourage active travel through green space planning. And in Highland, we're really at the beginning of thinking strategically about how we manage our green estate. And most recently, we've been involved in a national pilot project to map the habitats of our estate using UK habitat classification. And this was thanks to support and funding from Nature Scot, and we also benefited from support from NHS Assure as well. And this information can be used to form a baseline to measure improvements against, and it also can help us think a little bit about what we have available to us. So you can see this is a pie chart that shows the proportion of green space that we have. So we know that just under half of the estate that we own and lease is green space, and the other half is buildings and hard standing. And we've got about 30% of that is currently what we call amenity grassland, which is basically mown grassland. So to me, when I look at this pie chart, I see that 30% green wedge is just the wedge of opportunity. So there's so much that could be done with those spaces that could improve them for biodiversity and for people. And this UK habitat classification baseline can also feed into natural capital accounting. So thinking about ecosystem services, trying to think beyond just how much we're spending on these spaces in terms of finance, thinking about what do these spaces provide for us and what can we how can we enhance them to provide more for nature and for people. There's also a few projects that are happening already in NHS Highland land, and strategically and sort of at board level, we can't take credit for these. These are projects that have come from community interest and from the passion and dedication and drive of many of our clinicians. One example is at Badenoch and Strathspey Community Hospital, and there's a community organisation running a therapy garden there, and they were really involved. There was a new hospital built there a few years ago, and they were really involved in the kind of design stage. So it's an integrated site that they now use for therapeutic purposes with both community members. I think actually mostly community members that utilise that site. And the other project I wanted to highlight was Rigmore Gardens, which is a project that's focused at our district general hospital, Rigmore. And most recently, we've been engaging with landscape architects to develop concept design plans for staff and patient accommodation, and trying to integrate ecology recommendations into that as well. So that was another project that I wanted to highlight. And obviously there's challenges in driving this work in the context of a stretched healthcare system and within current budget constraints, and engaging with key staff teams and getting the buy-in at board level is understandably challenging, but it's something that we are looking to do.
Thank you. And Kate and I both work for NHS Highland and the public health team, but we recognise that in order to achieve this, communities are key and incredibly valuable to bring along with us. So Highland is very large. We're the size of Belgium. We're 2/3 of the landmass of Scotland. And so we divide the area into 9 community planning partnerships. And it's at this area level that locality planning happens, cross-service locality planning and engagement with the communities. So what we've done is we've published some guidance on nature, climate and health for the community partnerships, all of whom who have a key aim of reducing inequalities in their communities, but not all of whom until recently had engaged discussions with their environmental organisations and groups in that. And I think more and more we're seeing the value of bringing environmental groups and those working on climate change into those discussions to give them a governance route. And also it's a two-way thing for them to advise the community partnership, but also for the partnership to help guide them as to who the groups of people in their community are at most need, and we should be directing our work towards. So again, that publication will be shared in the references and it's available on our website. Hot off the press is that next week is Green Health Week. It's the 11th to the 18th of May, and we'll be running a lot of stuff on our social media accounts throughout that time, and there's a sort of day-by-day activity guide on our website of what's happening across Highland. But the exciting thing is we're launching a new climate, nature and health charter. There existed a climate charter in Highland for the last few years, and we've revamped it and relaunched it to include climate, nature and health together. It's a pledge to put climate, nature and health and the benefits of green and blue health at the centre of decision making and action, so that the natural environment and people have improved health, well-being and resilience. We've invited chief executives and leads from all our Highland organisations to come to a launch this time next week at the Inverness Botanic Gardens. But we're also inviting Highland individuals to sign up. We've got a new website there that's just being finalised as we speak. And what we hope is that we will get organisations to tell us each year what they're doing towards that pledge and that commitment. And it's just to carry the momentum forward and integrate this work to be more sustainable. We have integrated green health principles into 26 local programmes, plans and strategies to date. And the key thing will to be maintain that and keep that going and build on that going forward. The final thing for me to say is within the health service, we are linking our work more directly with the initiative around realistic medicine. Realistic medicine is very much taking a person-centred care approach to health and well-being, and looking at the whole person and not just the illness or injury that they have. And the work that we do around green health aligns with this so well, because what we're trying to do is work with link workers and others to encourage and promote activity in nature for people's well-being, which in turn is going to help to reduce their dependency on pharmaceuticals or postpone the need for it, which helps to reduce waste and harm. And it also helps to provide innovative new approaches to treating conditions, for example, branching out, which is a wonderful 12-week programme for people with moderate to severe mental health issues, which has been really highly evaluated, fits really nicely with the realistic medicine model. So it's early days with this, but we are going to be working more closely with those within NHS that are leading on realistic medicine going forward. So just before we invite some questions, just a bit of a summary, really. Hopefully you've learned today that nature is good for our health, that more people are engaging with nature than they were in 2019. Through our actions in NHS, we can increase nature connection for health. Nature is equigenic. It breaks down those gaps between the wealthiest and poorest. The biodiversity crisis and the climate emergency are a health emergency. There are co-benefits for health and climate and biodiversity action, and we should consider the environment as a determinant of health when implementing actions to reduce inequalities. I'm going to open it up for questions now, and obviously Kate and I are available on the email at any time if any of you want to follow up with us after this. I've put your cameras on now. They'd been off throughout the course, so if you have any questions, just do raise your hand. and then we'll invite you in to join us. But thank you so much for signing up to join us today, and I hope you found that interesting.
And thank you to everybody for your involvement as well. There's been some really great resources shared in the chat and for taking part in all the activities. It really helps in delivery as well. So big thanks for that.
I think it's stunned silence. Or are we going to get off lightly?
Sinclair's asking, will the recording be shared? Yes, I think that is the intention, Sinclair, is to share the recording with everybody who signed up to the seminar. And yeah, you're welcome to share that wider. That's absolutely fine.
Great. Well, thank you everyone for attending, and I'll try and send the reference notes, the slides and the recording out later this evening, so you've got a copy of that for the future.
Oh, and one last thing, sorry, while I remember, I'm being tardy here. I have a quick evaluation just to share with you that would be really appreciated if you have a chance to complete it. That would really help us with just understanding how useful the session was and any improvements we could make for any future